going to look at the important AE. AE stands for the adverse effects, and this is the adverse effects of the anti-epileptic drugs. Anti-epileptic drugs. So this is what we are going to read, and now we'll be discussing some anti-epileptic drugs and next the adverse effects. So to start off with the carbamazepine. So carbamazepine, the adverse effect here is that it can cause the Stevens-Johnson syndrome. Then it can also lead to the diplopia. Next is it can also lead to the ataxia and the hyponatremia. So to repeat, SJS, that is Stevens-Johnson syndrome, diplopia, ataxia, as well as the hyponatremia. Now we'll move on to the next drug. The next drug is the phenytoin. We are going to look at the phenytoin. So a phenytoin, it contains the gum hyperplasia. Next, it also contains the hirsutism, and then it also contains the osteomalacia, and the ataxia. This gum hyperplasia, the hirsutism, osteomalacia, and the ataxia. Next, we are looking at the valproic acid. So, the valproic acid, there is the presence of the hepatotoxicity. So, there is hepatotoxicity, and next comes there is the thrombocytopenia. As well as the transient alopecia. Next comes there is presence of tremors. And the pancreatitis. So later on we move on to the phenobarbital. So what is this? Phenobarbital. So under the phenobarbital, it includes there is sedation. Next comes there is depression, as well as there is ataxia and automatism. Then we are going to look at something known as the vigabatrin. So vigabatrin, the adverse effect is that there is loss of the peripheral vision. There is loss of the peripheral vision. Then we look at the felbamate. So what happens in felbamate? So in case of the felbamate, there is fulminant hepatic failure. So F4F, there is a fulminant hepatic failure, and there is also the aplastic anemia. This is all associated with the felbamate. So there is aplastic anemia. Next, we are going to look at something known as the lamotrigine. So under lamotrigine, there is a hypersensitivity reaction as well as the SJS. And later on, we move on to the topiramate. So under topiramate, we are looking at the adverse effect of the paresthesia. Next, there is also the renal calculi. Then comes the weight loss, as well as there is acute glaucoma. So to repeat, there was paresthesia, renal calculi, weight loss, and the acute glaucoma. Next, we are going to look at the oxcarbazepine. oxcarbazepine. So what happens in this oxcarbazepine? So here the adverse effect is that there is hyponatremia, as well as there is SJS. SJS stands for the Stevens-Johnson syndrome. Next we are looking at the ezogabine. So in case of ezogabine, the adverse effect is that there is urinary retention. Then comes the zonisamide. Zonisamide, it is the renal calculi which can be seen. That is renal calculi. So ezogabine, there is urinary retention. Zonisamide, there is renal calculi. Then when you are looking at the perampanel, so perampanel, there is a homicidal ideation. So this was about the antiepileptic drugs and the associated adverse effects. So to learn and grow daily like this, please do subscribe.